Treatment for lung cancer in Turkey. Oncological diseases are one of the most common reasons for seeking medical help abroad. Because in another country, you can expect sometimes better quality and better treatment conditions there. In this video, we're going to show you a specialized hospital in Turkey where they provide treatment for cancer patients, and we'll meet a doctor who specifically caters to foreign patients diagnosed with lung cancer. Do subscribe to us and please follow us not only on our YouTube channel but also on our Instagram account. There, Healthy Turkey consultant doctors share cases from their practice and talk about their professional work. Overall, our media channels are a vast database of information on medical tourism in Turkey. Lung cancer ranks first in prevalence among oncological diseases. Globally, approximately 1 million individuals are annually diagnosed with this specific cancer. As with any oncological disease, the prognosis for the patient depends on the stage at which treatment is started, as well as the effectiveness of the chosen therapy methods. Medicine in Turkey offers patients one of the best price-to-quality ratios in the world. You can find here an excellent hospital, skilled doctors, and the latest cancer treatment technologies at affordable prices. Many foreigners prefer to get medical treatment here. They come to us sometimes with health issues that cannot be resolved in their own countries, and we assist them in addressing these problems. Let's meet the thoracic surgeon oncologist, Dr. Necdet Oz, a specialist in his field. He received his general and specialized education at the Faculty of Medicine of Akdeniz University in Antalya and the Medical Education Center in the city of Yozgat. He is a member of the Turkish Association of Thoracic Surgery and the Lung Cancer Association. The symptoms of lung cancer can vary greatly depending on the location of the tumor and the stage of its progression. The most common symptoms include blood in sputum, loss of appetite, and weight loss. If the tumor is close to the trachea, it can cause tracheal stenosis, which means narrowing of the trachea. If the tumor is near the chest wall and affects the ribs, it causes significant back pain. Sometimes, in cases causing fluid accumulation between the lungs and the chest cavity, patients come to us with complaints of shortness of breath. Proper treatment requires a thorough and detailed diagnosis. First, we conduct a general examination of the patient, and their complaints guide us in this process. Then we perform standard blood tests, as there are no specific markers for lung cancer. General tests can indicate abnormalities in the patient's body, so we can check for any issues in the blood. The next step is to perform a chest X-ray. If the X-ray reveals any lesions in this area, we proceed with further examination when we use a computed tomography scanner. A CT scan examines the entire body for the presence of tumors. When a tumor is detected, we perform a biopsy. We are sending tissue samples to the pathology department for diagnosis. Diagnostics is one of the main areas of focus for Turkish oncologists. Specialized oncology clinics are equipped with well-furnished labs containing highly skilled specialists, diligently working to guarantee precision in their results. In one of our videos linked here, we showed an interview with the staff of such a laboratory. They demonstrated modern devices that make testing quick and accurate, ensuring reliable results. This allows for thorough treatment with individualized selection of tools and methods, ensuring the best possible care. There are two types of lung cancer, each with unique traits. One is called the small cell type, and the other is the non-small cell type. But within this last group, there are 10 to 15 different tumor varieties, each with unique features, and distinguishing between them is extremely important for proper treatment. While small cell tumors are primarily treated with chemotherapy and radiation therapy, for non-small cell types, surgery is added to radiation and chemotherapy along with immunotherapy treatments. The Oncology Council has recently placed a high importance on this matter, making it a top priority on their agenda. I should note that genetic research has now come to the forefront of medical studies. It shows whether the patient has a genetic mutation and whether can it be corrected. Patients are examined pathologically and genetically, and only then is treatment prescribed. Currently, the standard treatment for lung cancer is surgical operation. This procedure can be carried out in the beginning stages of small cell tumors, specifically tumors that are restricted to the lungs, not reaching the chest glands, and not attaching to major organs like the spine, large vessels, and heart. Surgery to remove the tumor area is the primary method for treating lung cancer. But sometimes we encounter special situations. For example, let's say we have an elderly patient. His overall condition is not favorable for surgery, and there is a possibility of him having other ailments such as heart disease, advanced chronic bronchitis, or kidney failure. All these conditions are very serious. Patients with severe age-related health problems often cannot tolerate chemotherapy treatments. In such cases, if the lesion is not very large and it measures less than 3 centimeters, localized radiation therapy can be performed. It is named radiosurgery. During this procedure, the limited area is intensely irradiated in an attempt to completely remove the tumor. But, as I mentioned before, this method cannot be used in all cases. Another approach is as follows. Sometimes small tumors in the lungs develop in locations where surgical intervention is simply not possible. In this case, we first administer chemotherapy, radiation therapy, and sometimes immunotherapy to reduce the tumor size, and then we re-examine them thoroughly. The most important factors affecting treatment are the type of tumor and its stage, second, third, or fourth stage. Of course, there can be different cases, including exceptions. We talked about genetic mutations before, so, for example, even if a patient is 80 years old with advanced disease, this issue may be due to a genetic mutation. In this case, we can give a specific smart medication which changes the patient's way of life. Research in this area is crucial, as lung cancer is the leading cause of death for cancer patients. Humanity must prioritize comprehensive investigation to combat this deadly disease. It is very important to research the effects of genetic mutations and the effects of so-called smart drugs. On one hand, the use of specific drugs is rapidly developing, and serious research is being conducted in the field of immunotherapy, mobilizing the human body's defenses to fight against cancer. On the other hand, robotics technology significantly contributes to progress. This is especially noticeable in surgery. Surgical robots are widely used now. They have become serious assistants in performing thoracic surgeries, both open and closed endoscopic procedures. I think this will be common everywhere in the future. We will be inserting a device into the body, which will initially capture images for diagnosis purposes. Once all the necessary scans have been completed, a biopsy will be performed using a robotic surgical procedure. Even now, hospitals in Turkey are well equipped with advanced robotic surgical systems, ensuring their good level of preparedness. Furthermore, Turkish oncologists have numerous other cutting-edge medical devices. After a cancer diagnosis, the patient has little time to choose a clinic and doctor. The sooner treatment begins, the more effective and less costly it will be. To avoid any mistakes in choosing a good clinic and doctor, it's advisable to consult independent doctors who know the specifics of particular hospitals and physicians.
After a person submits a treatment request in Turkey, we, the coordinating doctors at Healthy Turkey, select the best clinic and doctors for him based on the diagnosis, preferences, and needs. As practicing doctors in Turkey, we know precisely how to perform it accurately, swiftly, and effectively. Next, we coordinate with the patient the treatment plan and constantly accompany him throughout the trip, as well as stay in touch for any questions even after his return home.
To destroy the tumor without surgical intervention, doctors use nano-knives, microwaves, lasers, and radiofrequency ablation. These are different methods of targeting cancer cells using electromagnetic fields, laser beams, or high temperatures. The impact does not affect healthy tissues, so these methods are considered gentle. In combination with other treatment methods, targeted therapy using smart drugs is widely utilized. Drugs for targeted therapy are selected individually after tests that identify the type of genes and tumor proteins. If a patient requires regular drug administration, doctors often suggest installing a micro-infusion pump, such as the porta-cath system. It helps avoid unnecessary needle pricks with inevitable leaks of toxic medications outside the blood vessel's boundaries. Precise radiation targeting of the tumor is ensured by using linear accelerators, such as the Varian Rapid Arc. This American equipment helps to minimize the impact on healthy tissues and reduce side effects. What is the duration of the rehabilitation period on average? In fact, We often start the rehabilitation process even before treatment begins, during the preparatory period when the patient is still getting ready for surgery. This primarily concerns those who smoke, because when they come to us, they usually continue smoking. So, it's required that the patient quit smoking at least 10 days before surgery, and we start breathing exercises with them. These two important things ensure the psychological preparation of the patient for the surgery and allow him to have a more comfortable post-operative period. After surgery, the patient stays 1 day in intensive care and 5 to 7 days in a regular ward, and then within a period of 2 weeks, this person can return to life at home. That is to say, patients usually spend around 3 weeks in the hospital. Is it indeed true that Turkey's climate contributes to a better and more effective recovery after such treatment? I think it makes a lot of sense. From a climate perspective, Antalya is one of the best cities to live in. And obviously, such a tourist-friendly city is preferable for those who are recovering from severe illnesses, which most strongly affect a person's mental state, such as oncological diseases. That is to say, the adaptation process goes very well here. Therefore, I believe it would be beneficial for our patients to spend the rehabilitation period in a place like Antalya, where there is plenty of sunshine and fresh sea air. Turkey stands out from other countries with its comprehensive approach to patient care. In other countries, you often have to pay separately for each procedure. The arrangement of medical tourist visits to Turkey under the all-inclusive system is handled by Healthy Turkey, which works only with verified specialists, both in the field of medicine and in the hospitality sector, coordinating all their efforts for every patient. Healthy Turkey takes care of everything, from consultations and arrangements with the clinic and doctor, to transfers, accommodations, immigration formalities, and translations of medical documents. To get a free consultation, you can call this phone number or contact the company through the chat on this website. Here you can find also a lot of information on other health tourism fields. Don't forget to subscribe to our channel and don't miss new videos about medical tourism and assistance to foreign patients in Turkey.